Several months ago, a YouTube and beauty blogger from Germany contacted Seoul Guide Medical in regards to plastic surgery for her and her friend. Lisa and Miley flew over to Seoul to have their procedures with Dr. Chaemin at Answer Plastic Surgery. Dr. Chaemin is an expert plastic surgeon and has a great reputation for producing some of the best results in the world. Lisa underwent rhinoplasty, and Miley had rhinoplasty and fat grafting combined. Rhinoplasty is known as a nose job, nasal surgery, or nose reshaping. Traditional rhinoplasty involves changing the shape or the size of the bone, cartilage, and/or soft tissue of the nose to obtain a more pleasing shape and size of the nose. Why have rhinoplasty? If your nose is too small, large, flat, or broad, it can make your face seem out of proportion and unbalanced. Your nose is one of the most prominent facial features. Bringing more aesthetic harmony to your face through nose reshaping will make you look and feel more attractive, as well as improve your self-confidence. If your nose is crooked or irregular, it can be straightened and unsightly bumps can be smoothed out. Rhinoplasty may also be performed as part of a surgery to improve breathing through the nose with procedures such as septoplasty. Who is a candidate for rhinoplasty? Unless there are functional reasons for performing the surgery early, younger patients should wait until they reach full skeletal growth before having this procedure. For girls, this is at least 16 years old, and for boys, this is generally around 18 years, but this goes on a case-by-case basis. Is a standard rhinoplasty procedure the only way to improve the appearance of the nose? No. Non-surgical rhinoplasty like fillers, also known as a liquid nose job, and string lifting can be used. However, best results are usually achieved via full rhinoplasty, with non-surgical treatments being temporary. Rhinoplasty is usually performed in Korea using local anesthesia with sedation. In some cases, general anesthesia may be used. It is important to have a one-to-one anesthesiologist like here at Answer Plastic Surgery. The open method is the best as it allows for the surgeon to see internal structures, with the incision being made on the columella between the nostrils, which becomes virtually invisible over time. Most patients have little discomfort after rhinoplasty and feel no pain. They will wear a protective splint and tape for a few days following the procedure. Do your best to avoid bumping the nose or rolling onto your face during the night. Refrain from blowing your nose for approximately 2 weeks. Keep your nasal passages moist and clean. Be aware that smiling, coughing, and sneezing may be slightly painful. Keep cold compresses on the nose and eyes for 5 days to reduce the swelling, and another 5 days with a hot pack. Keep your head elevated as much as possible during the initial period of recovery, which will reduce the swelling and help the existing swelling resolve faster. Before the procedure, you may receive a specialized facial massage which can decrease the recovery time and prepare your face for the surgery as seen here. However, this is on a case-by-case basis. The second procedure being done on Miley is fat grafting. Fat grafting has been performed by plastic surgeons for decades. Fat is taken from one part of the patient's body, in this case the back of the thigh, processed and injected into needed areas elsewhere, in this case on the face. There is no question that the fat is the ideal material for soft tissue augmentation, and that the results obtained with fat grafting are the most natural appearing when performed by a plastic surgeon with expertise using ideal instrumentation. However, one problem with this procedure in years past has been reabsorption, breakdown of the grafted fat, so that the resulting improvement is not permanent. The grafted fat must gain its own blood supply in its new location in order to persist long term. And this is generally not possible when large amounts are injected at once, and when specialized instrumentation and techniques are not employed. A relatively new technique has been developed called structural fat grafting, in which small amounts, less than 0.1 cc at a time, of fat are carefully micro-injected in a series of discrete layers to gradually build new soft tissue structures. As there is space between each micro-injection, new blood vessels are able to grow into the grafted fat, allowing it to persist. If this process of blood vessel ingrowth, neovascularization, does not occur, then the injected tissue cannot truly be considered a graft. It is instead just another soft tissue filler of limited duration. This is a procedure that requires specialized training and specialized surgical instruments, as well as patience and attention to detail on the part of the surgeon. When performed properly, permanent improvements are possible. If enough fat reabsorption occurs following a fat grafting procedure such that the desired result is not achieved, a second touch-up procedure can easily be performed to augment the results obtained from the first injection. At Answer Plastic Surgery, Dr. Chaemin provides a free second fat grafting procedure if done within 2 months after the initial procedure. This is to ensure that your fat grafting procedure has the highest chance of success for the long term. On the day of the surgery, you will need to change into hospital gowns. If you are wearing makeup or contacts, you will need to remove them. A good tip is to wear comfortable clothing such as zip-ups instead of pullovers for after the procedure. You should also remove your nail polish on your hands and feet, as the nursing staff will need to monitor your vitals during the surgery. You will have your blood pressure taken and undergo a series of final questions. Go over the procedures with the manager and then with the doctor, and finally sign papers which are required by Korean law. Before the surgery, you may be placed into a private room as Lisa and Miley are here. This is a good chance for you to relax and get ready for your procedure. Before we continue, make sure you head to www.seoulguidemedical.com and send us your questions or get a free consultation online. After the surgery, medication will be delivered from the pharmacy right to the clinic, and you will be given a care package to take to your accommodations. Here you see their progress on day 3, day 4, day 5, day 6, and on the 7th day, the final taping comes off. The nose and face are still swelled and slightly bruised. The final results won't take place until 6 to 9 months later, however, improvements in the affected areas are seen right away. Because Miley had fat grafting and rhinoplasty, her swelling is larger than Lisa's. However, just 1 week later, the majority of it has dissipated. Here you see our 2 German patients in our recovery room on the 7th day. Just like them, you need at least 7 days in Korea, including the surgery day, for these procedures. More time is always better, but if you only had 7 days, that would be enough. Miley was busy with work back in Germany and couldn't be in Lisa's video to show the after effect, but sent in these photos at the 2-month mark so you can see her progress. To see Lisa's full progress several months later and to watch her detailed video, head to the link in the description box below. If you are interested in plastic surgery, vision correction, skin treatments, dental, or other medical procedures in Korea, contact us at seoulguidemedical@gmail.com for a free consultation. If you found our video interesting, like it, share it, and subscribe today.